Hi, my name is AArsalan, and for Unit 7 discussion I will be discussing mental health needs of special population. The elderly or geriatric population comprises of individuals aged 65 years and above. It is crucial to recognize the prevalence of mental health complications within this group. Studies indicate that around 14% of elderly population experience mental health complications. Diagnosis and DSM-5 criteria. It is crucial to understand the diagnosis hurdle faces when identifying mental health disorders in elderly population. DSM-5 criteria, which provides a standardized framework for diagnosis. First, depression is characterized by persistent sadness, loss of interest in previously enjoyed activities, disruption in sleep patterns, and changes in overall sleep quality. Anxiety disorders present with symptoms like excessive worrying, phobias, and episodes of panic attacks. Lastly, dementia manifests as progressive decline in cognitive abilities and memory, significantly impacting daily functioning and thought processes. Treatment plan. Pharmacological interventions play a significant role in managing these conditions. Among the commonly prescribed medications are selective serotonin reuptake inhibitors such as sertraline and citalopram. Additionally, selective norepinephrine reuptake inhibitors such as venlafaxine and duloxetine, as well as norepinephrine reuptake inhibitors such as bupropion, are often utilized. Alongside medication, psychotherapeutic interventions are crucial components of the treatment plan. Cognitive behavioral therapy and interpersonal therapy have shown effectiveness in addressing various mental health issues in this population. Prenatal and lactation population. Mental health challenges within this group often arise during two crucial periods: pregnancy and breastfeeding. One of the most prevalent complications faced by prenatal and lactating mothers is prenatal mood and anxiety disorder, affecting a significant population, up to 20% of postpartum women. It is important to recognize the far-reaching consequences of these complications. It does not only affect the mother themselves but also impact their babies and entire families. Diagnosis and DSM-5 criteria. Specific diagnostic criteria outlined in DSM-5 for prenatal mood and anxiety disorders include intense fear and uneasiness, often characterized by heightened anxiety levels; pervasive and constant worry, which may manifest as excessive concern about the well-being of oneself or the baby; intrusive and racing thoughts, which can be distressing and difficult to control; changes in appetite, such as overeating or loss of appetite, which may indicate disruption in normal eating patterns; a sense of impending doom, where individuals may feel a looming sense of danger or dread; restlessness, characterized by an inability to relax or sit still, often accompanied by feelings of agitation. Treatment plan. Among the commonly prescribed medications are selective serotonin reuptake inhibitors such as sertraline and citalopram. However, it is important to note that non-pharmacological interventions are also crucial components of treatment plan. These include CBT and interpersonal therapy, which have shown effectiveness in addressing prenatal mood and anxiety disorders. Involving family members, friends, and utilizing community resources can provide essential emotional support and practical assistance to prenatal or lactating mothers undergoing treatment. Pediatric and adolescents population. The pediatric and adolescents population are children aged between 9 to 18 years. Studies indicate that globally up to 20% of children and adolescents experience mental health issues. The major mental health conditions prevalent in this population include depression, attention deficit, hyperactivity disorder, and behavioral disorders. The economic burden associated with mental health infirmities in this population is considerable. The cost burden arises from various factors, including prenatal health care, hospitalization, and the use of medication. Diagnosis and DSM-5 criteria. DSM-5 for depression. The criteria includes persistent sadness, loss of interest or pleasure lasting at least 2 weeks, accompanied by various physical and cognitive symptoms such as changes in appetite, sleep disturbances, fatigue, feeling of worthlessness, excessive guilt, difficulty concentrating, and even suicidal thoughts. ADHD is characterized by symptoms of inattention, hyperactivity, and impulsivity that significantly impair functioning. These symptoms may manifest as trouble concentrating, excessive talking, and impulsive behavior. Behavior disorders often present as defiance, irritability, arrogance, and argumentative or vindictive behaviors, impacting relationships and functioning in various settings. Treatment plan. For depression, selective serotonin reuptake inhibitors are often prescribed, while stimulant medications are commonly used to address symptoms of ADHD. Psychotherapy, including cognitive behavior therapy, family therapy, and interpersonal therapy, has shown effectiveness in addressing various mental health issues in this population. LGBTQ population. LGBTQ comprises of lesbians, gays, bisexuals, transgenders, and queers. This population experiences a higher prevalence of mental health challenges compared to heterosexual individuals. This disparity originates from various factors, including social stigma, isolation, discrimination, and chronic stress. Diagnostic and DSM-5 criteria. The DSM-5 diagnostic criteria for most common mental health issues in this population include depression, persistent sadness, apathy, and previous enjoyable activities, sleep disturbances, and changes in sleep patterns, anxiety disorders, excessive worry, phobia, and panic attacks, substance use disorder, hiding to partake substances, difficulty maintaining relationships, and substances use affecting work or daily functioning. Treatment plan. Treatment plan includes pharmacological interventions such as SSRI as sertraline and citalopram, and hormone replacement therapy. Non-pharmacological interventions such as individual and group cognitive behavior therapy, trauma therapy, support groups, social support from friends, family members, and community resources. Immigrant or migrant population. The immigrant worker population consists of a diverse group of individuals who have temporarily or permanently migrated from their country of origin for work or economic opportunities. Individuals from this population face unique challenges that increase their risk of mental health issues. 39% of immigrant worker population experience depression, while 27% experience anxiety disorder. The economic costs of mental health issues are significant due to productivity costs, medications, and hospitalization. Diagnostic and DSM-5 criteria. The DSM-5 diagnostic criteria for most common mental health issues in this population include depression, which can be diagnosed with persistent sadness, apathy, sleep disturbances, changes in sleep pattern, financial constraints, limited social support, weight loss, hypersomnia, psychomotor agitation, reduced thinking, and social thoughts. Anxiety, which can be diagnosed with excessive worry, phobia, restlessness, panic attacks, irritability, muscle tension, and sleep disturbances. Treatment plan. Treatment plan includes pharmacological interventions such as selective serotonin reuptake inhibitors like sertraline and citalopram, and non-pharmacological interventions such as cognitive behavior therapy, narrative exposure therapy, trauma therapy, and support groups. Ethnic minority groups population. It includes individuals from a wide range of backgrounds, including African Americans, Asian Americans, Hispanic, Black Hispanics, non-Hispanic whites, and multiracial Americans. Despite a high prevalence of mental health disorders within these communities, there exists a significant disparity in accessing essential healthcare services. Discrimination, stigma surrounding mental health, poverty, racism, and lack of culturally competent providers limit access to healthcare by this population. Diagnostic and DSM-5 criteria. The DSM-5 criteria for the most common mental health issues in this population include depression, which can be diagnosed with persistent sadness, apathy, and previous enjoyable activities, sleep disturbances, and changes in sleep patterns, anxiety disorder, excessive worry, phobia, and panic attack, substance use disorders, which can be diagnosed with hiding or partake substances, difficulty maintaining relationships, substance use affecting work or daily functioning. Treatment plan. Treatment includes pharmacological interventions such as SSRI, sertraline, and citalopram, SNRIs like venlafaxine and duloxetine, and non-pharmacological interventions such as cognitive behavior therapy, trauma therapy, support groups, social support from friends, family members, and community resources.